Blood, it tells a story. A silent witness at a crime scene. A single drop can reveal the truth. It can identify a victim, link a suspect, and reconstruct events. Bloodstains, patterns, and DNA within the blood provide crucial information. They unlock mysteries and help bring justice. But collecting blood evidence requires precision. Each step, if not done right, can compromise the entire investigation. That's why understanding the process is vital. From preparation to transport, every action matters. The integrity of the evidence depends on it. Before approaching the blood evidence, safety comes first. Personal protective equipment, or PPE, is non-negotiable. Gloves, a mask, eye protection, and a gown create a barrier against potential health risks. Next, gather the necessary tools. Sterile swabs, gauze pads, distilled water evidence collection containers, and tamper-proof evidence tape are the essentials. Documenting the scene meticulously is crucial. Take photographs of the bloodstains before collection. Note their location, size, and any unique characteristics. When collecting liquid blood, use a sterile swab or gauze pad. Avoid touching the blood directly. Package the swab or pad in a paper container, allowing it to air dry completely. Seal the container with tamper-proof evidence tape. If the blood is dry, moisten a sterile swab with distilled water. Gently swab the stain, collecting as much as possible. Allow the swab to air dry and package it as described above. Wet blood stains on clothing or other materials require special handling. Never package wet items. This can lead to mold growth and DNA degradation. Instead, allow the items to air dry completely at room temperature. Once dry, package them separately in paper bags. Seal the bags securely with tamper-proof evidence tape. Proper storage is crucial for preserving blood evidence. Store all collected samples in a secure location. This location should be temperature-controlled and protected from direct sunlight. Label each piece of evidence clearly. Include the date, time, location of collection, and the collector's initials. This documentation ensures proper tracking and chain of custody. Section 6. Keeping it cool, transporting blood samples. Transporting blood evidence requires extra care. Use a cooler or insulated container to maintain a cool temperature. Avoid extreme heat or cold, which can damage the DNA. Keep the evidence sealed and secure during transport. Record the date, time, and names of individuals handling the evidence. This documentation helps maintain the chain of custody. Section 7. Chain of custody. Tracking the evidence trail. The chain of custody is a critical record in any investigation. It documents everyone who handles the evidence from collection to analysis. This chain must be unbroken to ensure the evidence's integrity in court. Each time the evidence changes hands, document it. Include the date, time, reason for transfer, and signatures of both parties involved. This process ensures accountability and prevents tampering allegations. Section 8. Contamination is key. Avoiding evidence mishaps. Contamination is a serious risk when handling blood evidence. Always wear clean PPE. Change gloves between handling different pieces of evidence. Use sterile collection tools to prevent cross-contamination. Avoid touching your face, hair, or other objects while collecting evidence. These precautions help maintain the evidence's integrity. Section 9. Justice served. The importance of proper collection and preservation of blood evidence are crucial for achieving justice. By following these steps, investigators can ensure that this silent witness speaks volumes in court. The smallest detail can make or break a case. Meticulous collection, documentation, and handling safeguard the truth. Ultimately, it's about seeking justice for victims and holding perpetrators accountable for their actions.